Can we start our class in another 2 to 3 minutes? Good evening, everyone. Once again, can we start now?
Good evening. Yes, we can.
Is my whiteboard visible to everyone?
Yes.
Yeah.
No.
Not visible?
Not
Visible.
visible.
Yes, it's visible.
It isn't.
I think it may be the problem of your Microsoft Word version, or maybe the problem of your email ID verification. But I hope you are good to start. Can somebody start recording the class? Those only who have the whiteboard, please start recording. Otherwise, let me start recording. Yeah. Today we are moving on with the solid dosage forms in pharmaceutics 1. We are going to look into 2 solid dosage forms. The first one, is tablets, and then once we are done with the tablets, tomorrow we can look into the capsules. So let us see about the tablets today. So in tablets, we are going to look at the definition for the tablets, advantages, disadvantages of tablets, classification of tablets, formulation, preparation, and evaluation of tablets. So let us start with the definition for the tablets. Tablets are defined as unit solid dosage forms. As one dosage form is exactly going to give you one dose of the drug, we are going to call them as unit dosage forms. As they are present in the solid form, we are calling them as solid dosage forms. So they are unit solid dosage forms in which medicament along with the other ingredients. There may be a single medicament or you may have the multiple medicaments. Unit solid dosage form in which medicament or medicaments along with the other ingredients are compressed in the form of a small disc.
Compressed
In the form of a small disc. So we apply compression pressure or we apply compression force. We can call it as compression pressure or force. We apply compression force and then we prepare them into small disc-like structures. So these disc-like structures are nothing but the tablets. I repeat the definition. These are the unit solid dosage form in which medicament or medicaments along with other ingredients are compressed in the form of a small disc. So this is the definition for the tablets. Unit indicates you single dosage form is going to provide you single dose of the drug. This is the form of the dosage form, solid. And here we are going to have one important term, which is compressed. We are going to use heavy compressional machines in which we are going to apply compression force, either powder or granules. We may either use the powder of the drug along with the ingredients, or we may go for preparing them into granules. And then we apply this compressional force and we go for the preparation of small disc-like structures called as tablets. Am I clear with the definition?
Yes.
Yes, clear. Clear, Prof.
Yeah. Yeah.
Yes.
Now let's look at the advantages and disadvantages of the tablets. These are the smallest dosage forms. These are also lightest dosage forms. The minimum weight of the tablet is right from 1 mg to a maximum weight of the tablet as 1000 mg. So these are the weights for human purpose. We may even have tablets of 1500 mg, 2000 mg, which is meant for veterinary purpose. But for human purpose, we will have a minimum weight of 1 mg to maximum weight of 1000 mg, which is the lightest weight. When you consider the liquid dosage form, 5 ml is the minimum dose, or 2.5 ml is the minimum dose. When you convert this into grams, it is 5 grams or 2.5 ml, 2.5 grams. So now you can have the comparison. In liquids, the minimum weight is 2.5 grams, whereas in tablets, the minimum weight is only 1 mg. Now you compare 2.5 grams and 1 mg. 2.5 grams is nothing but 2500 mg. 1 mg is entirely different from this 2.5 grams. That's the reason we call tablets as the smallest and lightest dosage forms. So this is the reason why they can be packed in a very minimum space. So you don't require large space. You don't have problems in transportation. You don't have problems like leaking. You don't have problems like accidental breaking, nothing. So these are the smallest dosage forms, lightest dosage forms, will have dose accuracy. There is no need of any measuring cup. There is no need of dividing the dosage form into individual doses, because doses are already present as divided ones. We already have a single dose present in single dosage form. So once the patient consumes a single tablet, it is ensured that the required dose of the drug is administered. So there will be high dose accuracy. As I told you, there is no spilling, there is no accidental breaking, there is no leaking. They don't occupy more space during storage. They are easy to transport. So these are all the advantages with the tablets. We even have another advantage that modifications are possible. You can do many modifications when you are manufacturing the tablets. Everybody please mute your mics. Thank you. So we even have option of modifications like we can see coated tablets. We can have sugar-coated tablets and film-coated tablets. Not only that, we even have layered tablets. In the market, you might have seen a single tablet divided in this direction into different layers. Each layer is given its own color. One layer may be orange in color, the other layer may be white in color, the last layer may be blue in color. So these are called as layered tablets. The purpose of preparing these layered tablets is, suppose it has two drugs which interact with each other. When you add them together, they interact with each other. So what we are doing is, first drug we are preparing as a first layer, then we are going for a layer of inert ingredients. Then we'll go for the layer of the second drug. So you have the first drug, second drug in a single tablet, but both the drugs are not in contact with each other. So we are preventing chemical interactions that happen between these two drugs. So we even have the chance of preparing coated tablets, layered tablets. We even have the option of preparing slow release tablets, sustained release tablets, repeat action tablets. So thus, with the modifications, it is giving wide options for efficient drug delivery. So this is another advantage with the tablets. So you don't require any measuring device. So these are all the advantages with the tablets. These are the smallest dosage forms, lightest dosage forms. There will be high dose accuracy. No problem of spilling, breaking, or leaking. They occupy very minimum space during the storage and also comfortable for handling. They're easy to transport. They don't require any measuring device. They even provide you the options for modifications like coated tablets, sugar-coated and film-coated, layered tablets, slow release tablets, sustained release tablets, and repeat action tablets. We do even have other options. I'll explain those things when I go for the classification of tablets. Any doubts in this?
No. No.
Which one?
Yes,
Any-
sure.
Okay, can I move on to the disadvantages of tablets?
Yes,
Yes,
move on,
Prof.
Prof.
Yes.
Yes, Prof.
Disadvantages with the tablets indicate you they are manufactured by using heavy compression machines. Manufacturing is not simple. We need to have thorough knowledge about how these compression machines are used, how to set the parameters, how to handle the machine. Then only we'll be able to manufacture tablets. They'll also have manufacturing problems like if they are not manufactured properly, they'll result in the manufacturing problems like cracking. The tablet will have visible cracks because it is the granules present in the tablets are not bound together. So like how we'll see cracks in the walls, we'll be able to see the cracks in the tablet surface. So that problem is called as cracking. And also we'll have the problem of sticking. One tablet gets sticked onto the other tablet. Picking. Picking indicates you from the tablet surface, you'll see the formation of some holes. Why do you have the formation of these holes is the granules present on this surface are picked by the tablet punching machine during the process of manufacturing. So now the tablet surface is not complete. Some of the granules from the tablet surface are picked by the tablet punching machine. So this problem is called as picking. We will also have the problem of capping. And also we'll have the problem of lamination. So now what do you mean by the problem of capping and lamination is when you look at the tablet, it will be intact like this when it is stable. But when it has the problem of capping or lamination, a single tablet will get divided into different layers. So when you have the formation of these layers, you call this problem as lamination.
Sarah, ekela food.
When only at the top crown or bottom crown separates out from the tablet, then you call the problem as capping. When a single tablet gets divided into multi-layers, the problem is lamination. Only the top layer of crown or bottom layer of crown separates from the tablet, then you call that problem as capping. So there will be chances for cracking, sticking, picking, capping, lamination, and also mottling. Mottling indicates you color variation on the tablet. Tablet must look uniform in color. Either it is the white color or it is the yellow color or it is the red color. Whatever may be the color of the tablet, it must appear uniform throughout its surface. In the problem of mottling, one part of the surface will be dark in color, the other part of the tablet will be light in color. So which is called as color variation or the problem of mottling. So there will be manufacturing problems like cracking, sticking, picking, capping, lamination, and mottling. Formulator needs to adjust the formulation very, very carefully so that we are not going to experience any of these problems. If there is a problem in formulation, if the ingredients are not adjusted properly, we will go for the preparation of the granules, we'll go for the punching of the tablet, but whatever the tablets that are forming is going to have the problems of all this. When you have even a single problem, like you have a problem of picking, you have a problem of sticking or cracking, anything, then the tablet will be thrown out of the market. We don't even release those tablets with the manufacturing problems into the market. So the total batch gets wasted when the tablets are going to have any of these manufacturing defects. So formulation needs to be prepared very, very carefully. Another thing is, now you see, when you want to target the mechanical strength, so here's to you. It is going to influence the release properties. Mechanical strength indicates you tablet needs to be intact. Our tablet is expected to maintain its integrity of shape and size. In order to have proper shape and size, we need to make this tablet hard. If the tablet is soft, it will break easily, it will get damaged easily, it will lose its shape and size. Suppose if formulation is prepared so that it becomes hard, then it is going to affect the properties of release. Of course, the tablet will be hard now. It will maintain the size and shape throughout the storage period, throughout the transport, throughout the handling. It will maintain its shape and size. There won't be any problem. At the moment it is administered, the tablet needs to break down into granules, and the granules needs to break down into powder. So which is called as disintegration and deaggregation. If the tablet is hard, we cannot expect disintegration to happen. We cannot expect deaggregation to happen. Because the tablet is very hard. A simple environment of GIT with the absorption of moisture, the tablet may not undergo into granules and granules may not get into powder. Suppose you want to get more amount of drug release, then you need to make the tablet soft. When you are making the tablet soft to have more release, then this will influence the mechanical properties. During the transportation, the tablet may break because it is soft. When the patient is handling, the tablet may not be able to maintain its shape and size because it is soft. So these two properties, which are the important properties of the tablet, they are interlinked with each other. When you are trying to improve one property, the other set of properties will get decreased. Or when you are trying to increase the release, mechanical properties will decrease. When you try to increase the mechanical properties, the release properties will decrease. So these two important properties are inversely proportional to each other, and they will have more and more influence on the therapeutic action of the drug. So because of this and because of the manufacturing problems, we need to be very careful about the formulation of tablets. Am I clear?
Clear.
Clear.
Okay. So let us look into the classification of the tablets. Tablets are classified as the tablets taken through oral cavity, the tablets used to prepare solutions, the tablets which are taken other than oral cavity. So tablets which are taken through oral cavity, tablets which are meant for preparing solutions, tablets which are used other than oral cavity. So tablets which are taken through oral cavity are again divided into two classes. Tablets which are meant for swallowing, tablets which are meant for using in buccal cavity. Tablets which are meant for swallowing are the normal tablets that we take and we swallow with the minimum quantity of water. Tablets used in buccal cavity are again three types. chewable tablets. These are not meant for swallowing. Sorry. Some are meant for swallowing, some are not meant for swallowing. They are not meant for swallowing. All the tablets are not meant for swallowing. Chewable tablets, buccal tablets, and sublingual tablets. So here chewable tablets are meant for chewing and then swallowing. Chew and swallow. Buccal tablets are meant for keeping it in the buccal pouch. They are not meant for swallowing. The drug enters into the buccal mucosa and from there it enters into the systemic circulation. Sublingual tablets are meant for keeping them beneath the tongue. So these two tablets are the specialized tablets which are meant to bypass first-pass metabolism. Because the drug, when enters into GIT, will enter into the mesenteric circulation. And from there, it enters into liver and then enters into the systemic circulation. So when the drug enters into liver, it gets converted into its inactive form. So before entry into the systemic circulation, the drug is converted and only inactive form is entering into the systemic circulation. In those cases, there is no meaning of taking the drug through the GIT. So the alternative routes of administration are either buccal route or we can go for the sublingual route. Both in buccal route and sublingual route, the tablets are not meant for swallowing. The tablets are prepared with bland ingredients. Why do we prepare them with bland ingredients is there won't be any addition of sweetening agents, there won't be any addition of flavors. They need to be bland. If we go for the addition of sweetening agents or flavors, they start stimulating saliva. When saliva is secreted, the drug enters into saliva and this saliva is swallowed into GIT. When saliva is swallowed into GIT, it will again have the same process of mesenteric circulation, liver, and again getting inactive. So from the buccal route, from the buccal mucosa, or from the sublingual mucosa, the drug directly enters into systemic circulation. It is not passing through liver, so we can avoid the metabolism or its conversion into inactive form by giving the drug through either buccal route or sublingual route. So that is the buccal tablets and sublingual tablets. Chewable tablets are especially for antacids. Generally, antacid tablets and vitamin C tablets, the dose is more than 1000 mg. When the dose is big, the tablet size increases. When the tablet size increases, swallowing becomes a problem. All the patients may not be able to swallow those big tablets. So in those cases, what we do is we'll just go for preparing the chewable tablets. They are chewed in the mouth and then swallowed into the GIT. So when they are meant for chewing in the mouth, we go for the addition of more and more amount of sweeteners. We go for the addition of more amount of flavors. Then only chewing is possible. If they are not good in taste, we cannot chew the tablet. So with the chewing, what happens? The tablet undergoes disintegration into granules. and then it gets disintegrated into powder, and this powder will now directly enter into GIT. So when in case of antacids, as it is converting into granules and converting into powder and entering into GIT, will have increased surface area. When you have an increase in the surface area available for neutralization is going to be more, which can show maximum therapeutic efficiency. So that is the advantage with chewable tablets. Especially antacids and vitamin C, because of high dose, swallowing becomes tough. So we prepare them with slight modification. We prepare the same tablet. Size is big, but that is not meant for swallowing. It is meant for chewing in the mouth and then taking those granules or the powders into GIT. So the patient is suggested to chew it thoroughly before swallowing. So this chewing makes the tablet to get converted into granules and granules into powder, increasing the surface area and also providing more surface area for execution of therapeutic activity, especially for antacids. So they are meant for neutralization of acid secreted in GIT. So when the surface area is more, there will be quick neutralization of the acid. So which is going to even add on the therapeutic efficiency of the drug. So these are the tablets which are meant for using in the oral cavity. So the tablets which are taken by oral cavity are again two types, which are meant for swallowing. The normal conventional tablets, which are meant for be used in the buccal cavity. So these are again three types: chewable, buccal, and sublingual. Am I clear with the first class of tablets?
No.
You want me to repeat anything?
Yes, please.
Yes.
Could you, the buccal and sublingual,
Buccal,
please, is a bit not clear to me.
no problem. So
Difference.
buccal and sublingual tablets, these are the specialized tablets which are meant for keeping them in the specific area of the oral cavity. Buccal tablets, they are kept between the teeth and the cheek. So that is called as buccal pouch. So the tablets are kept in the buccal pouch and they are meant for slowly dissolving in the oral cavity. So when they slowly dissolve in the oral cavity, they get into the buccal mucosa and from there they enter into the systemic circulation. Even in case of sublingual tablets, the same thing happens. So the tablets are meant for keeping in the specific area which is beneath the tongue. So the tablet is slowly dissolves and then the drug enters into the sublingual mucosa. From there, it enters into the systemic circulation. So why are we targeting these specific areas in the oral cavity is not all the drugs are safe when taken through GIT. Because when taken through GIT, the drug is prone for first pass metabolism. From GIT, drug enters into liver, then only it can reach systemic circulation. So when it enters into liver, there is a chance that it gets converted into its inactive form. So we are preventing that step. So because of that, we are taking those routes of administrations which can overcome first pass metabolism. So buccal route and sublingual route are among those routes which can avoid first pass metabolism. The another precaution that we need to take when we are preparing buccal and sublingual tablets is we prepare them with bland ingredients. The ingredients doesn't have any taste. Because if it has some taste, there will be stimulation of saliva. And the drug enters into saliva. Either the saliva is swallowed into GIT or you may have to go for spitting of the saliva. When you are spitting the saliva, the drug will be wasted. When we are swallowing the saliva into GIT, again the drug is wasted because the drug is prone for phosphorus metabolism in the liver. To prevent the salivary stimulation, we are going to prepare these tablets with bland ingredients. Am I clear now?
Yes, thank you.
Anything else that you want me to repeat?
Come again about the ingredient. You have called them what? Ingredient?
Which ingredients?
Yes, come the name. The tobacco
Which one?
tablets.
Somebody is asking about the ingredients. I didn't get to which tablet ingredients are you asking for?
The tobacco tablet. You have said about the ingredient that prepare the tobacco tablet.
We are going to use the ingredients which are bland. Bland means they don't have any taste. Yeah.
Bland, that is bland. The name is bland.
No. The name is not bland. Means that doesn't have any taste.
Okay.
B-L-A-N-D, bland.
Okay. Get it now.
Because when they are going to add some taste, then they will start stimulating saliva. Because
Yes,
these
no
tablets are not supposed to be swallowed into GIT. They are meant to be absorbed from buccal cavity. Hope I am clear now.
Yes, you are. You are.
Yes, Prof.
Yeah, the second class of the tablets which are made for preparing solutions. These are the tablets which are not meant for swallowing. These are meant for preparing the solutions and then taking those solutions. Dispersible tablets and effervescent tablets. You might be knowing the tablets which are added to a glass of water. The tablet dissolves into this glass of water and then the tablet is taken, that solution is taken through the oral cavity. So this is called as dispersible tablets. We will also have second class of tablets which are again put into a glass of water. The moment you keep this into glass of water, it will start producing effervescence, or you call them as bubbles. Bubbles are effervescence. So these two tablets are the ones which are used to prepare solutions, and then these solutions are swallowed. Dispersible tablets are going to give you complete clear solution the moment you keep them into water, or sometimes they may even form a suspension. Effervescent tablets, they are going to generate bubbles because of the release of carbon dioxide. From where are we getting this carbon dioxide is effervescent tablets contain the ingredients sodium bicarbonate with citric acid and tartaric acid. The moment they are in dry condition, they do not react with each other. The moment you add them to water, there will be acid-base reaction between citric acid and tartaric acid with that of the sodium bicarbonate. During this acid-base reaction, there will be evolution of carbon dioxide, which is going to give the formation of these bubbles. So those are called as effervescent tablets. Why are we preparing these effervescent granules, effervescent tablets? What is the reason? Is it to attract the patients? So that they start think these tablets as soda and they prefer taking these tablets. Is it because of that? It is not because of that. So when we have the drugs like aspirin, they irritate the gastric mucosa. This is because of the pH, which is around 1 to 2. At this pH, aspirin will start causing the lesions in the gastric environment. This will cause the formation of ulcers. To prevent that, this aspirin is added to effervescent granules. When it is prepared in the form of effervescent granules, because of the release of carbon dioxide, the pH of the gastric environment slightly rises to 4 to 5. At this raised pH, the action of aspirin on the gastric environment will be less. So we are preventing the formation of ulcers. And also aspirin gets more absorbed when it is given in the form of effervescent tablets. So thus we can have two different tablets which can be used to prepare solutions, and those solutions are swallowed. The first one, dispersible tablets. The moment you add this tablet to water, there will be formation of either clear solution or that may lead the formation of a suspension. The solution or suspension will be swallowed. So what is the purpose of preparing this is just increasing the ease of swallowing, because not all the patients are comfortable in swallowing the tablets, because it is not easy administration, especially for pediatric patients and geriatric patients. Administration of tablets is not that easy. To increase the convenience, we are preparing that in the form of a solution, and then that is treated. The second type of tablets which are made for preparing solutions is effervescent tablet. So this will have a combination of citric acid, tartaric acid, and sodium bicarbonate. Whatever the carbon dioxide present in this sodium bicarbonate releases the moment these ingredients come in contact with water. When the tablet is added to water, acid-base reaction takes place and there will be release of carbon dioxide. This effervescence increases the absorption and also decreases ulcer formation by aspirin in the stomach. Am I clear?
Yes.
Yes, Dr.
Yes, clear.
Yes, you are.
Clear.
Yes.
Then the third class tablets used by other routes of administration. Vaginal tablets, rectal tablets, and transdermal tablets. These are used especially for local action. Vaginal and rectal routes are used for local action. Transdermal route can be used both for local action and systemic action. Oral contraceptive hormones are given through a small implant. That implant is nothing but coated tablet. The tablet is coated with a film. So that film will take care of releasing the drug for longer durations. Maybe it is 1 month, or maybe it is 6 months, maybe it is 2 years, maybe it is 3 years also. A single implant will take care of releasing the drug for years together. So those are the transdermal tablets. We may even have the same tablets, but the route that we are using is different and the purpose that we are using is different. So that can be kept in the vaginal cavity for the infections, or maybe for the contraceptive purpose, or maybe to induce abortion. that can be used in the rectal cavity, maybe for relief from the constipation, or maybe in IBS, irregular bowel syndrome, or maybe some infections in the rectal cavity, maybe to get relief from the pain caused by hemorrhoids. In all these cases, we can go for the insertion of tablets into vaginal cavity or rectal cavity or into the transdermal. Here, vaginal cavity and rectal cavity and transdermal, it requires special instructions for the administration, because all the patients, they don't have good information about these routes of administration, and especially transdermal route of administration requires a minor incision also, because they cut the superficial layer of the skin and the tablet is inserted into the skin. That's a very minor surgery, but it requires some specialized technique. It is not meant for self-administration. All the other tablets are easy. They can be administered by self because they accurately deliver the dose. But especially the tablets which are administered by other routes, they are not administered by the patient. Am I clear?
Clear.
We do have another type of tablets like modified tablets. You cannot call them as a class, but you do have sugar-coated tablets, film-coated tablets, compression-coated tablets. Tablets are coated with the sugar to improve the taste. Tablets are coated with a thin film to modify the release. They will also mask the taste, and along with masking of the taste, they'll also help in modifying the release. Compression coating tablets are mainly meant for repeat action. When we were discussing about the advantages with the dosage form, we have seen about the compression coating tablets. So we first prepare a small tablet. Again, we'll go for the placement of the granules. And again, one more layer of coating is done, which will form layer compression coating tablets. So when this is put into GIT, initially the outer layer will start releasing the drug, release 1. Then the inner core gets exposed and it will take care of releasing the drug second time. This is called as repeat action tablet. So we also have the layered tablets which will enhance the compatibility. So these are the modified tablets by manufacturer. Am I clear?
Kindly repeat.
Kindly repeat.
Repeat on what?
The modified
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 tablets.
tablets.
All the tablets.
Yes.
Yes.
Modified.
Repeat action tablets.
Okay, modified tablets are sugar-coated tablets, film-coated tablets, and compression-coated tablets are layered tablets. Sugar-coated tablets means we take the normal tablet, we'll go for layering of the sugar. You might have seen, they just look like candies. So they'll go for layering of the sugar, and this sugar coating is dried, so they just look like the candies. So these sugar-coated tablets are especially for masking taste and also to attract the pediatric population. But you do have certain disadvantages with the sugar coating. The tablet weight increases almost by 100%. Suppose you started with 50 mg of the tablet. After completion of sugar coating, the tablet weight goes up to 100 mg, or it may even go up to 150 mg. So there is enormous increase in the tablet weight. The second disadvantage is they are not okay for all the population, all the patient population, like diabetic patients. They are contraindicated with sugar coating. And also whatever the sugar that is present, that will start causing microbial contamination if it is not stored properly. Because of these disadvantages, there is a second modification of tablet, which is film coating. In film coating, the tablet is coated with a thin layer of film. In case of sugar coating, the layer thickness may be 1 mm or the layer thickness may be up to 3 mm. Whereas in film coating, the layer thickness is in microns. They may be 10 microns, they may be 50 microns, or they may be 100 microns. Now you can see the difference. So there won't be any increase in the weight. Whatever the taste masking that is done by the sugar coating is also done by the film coating. Because when film is coated over the tablet, we cannot feel the actual taste of the drug. So we are masking the taste. Along with this, we can even go for modification of the release. Like when you coat with the films, which will release the drug slowly, which will release the drug in a controlled manner, which will also delay the drug release. So we can even go for the modification of release along with the taste masking. The next one, compression coating tablets. In compression coating tablets, we are going to have tablet in tablets. We have seen about this when we are looking at the advantages of preparing dosage form. There will be a tablet inside a tablet. So when this tablet gets released into the GIT, the outer layer gets disintegrated and it will start releasing the drug. This is release 1. After completion of the outer layer, now the inner core gets exposed to the GIT and now this will start disintegrating and this will start releasing the drug, which is a second release. So that's the reason you're calling them as repeat action tablets. So those are compression coated tablets. And we also have another modification, which is layered tablets. In case of layered tablets, when you want to incorporate more than a single drug, which are not compatible with each other, we can prepare them as layer 1, 2, 3, and 4. And we can even have inert layer in between. Suppose this is drug 1, then inert layer in between, drug 2, another inert layer in between, then drug 3. So thus, we can have a single tablet which is prepared as layers. We can see different colors of the tablet. Have you seen the layer tablets in the market?
Yes.
Yeah.
So that is to prevent the chemical interactions between two drugs, which we want to incorporate into the same tablet, but we are not expecting them to react with each other. So we are not allowing the reaction to happen by not making them coming in contact with each other. So thus we can go for the preparation of the layered tablets. Am I clear now about the modified tablets?
Yes.
Okay.
Yes.
Yes,
Now,
you are.
let us look into the formulation part of the tablets. Can we have a small break?
Yes, please.
Yes.
Just take 5 minutes break and come back.
Okay.
Okay.
you.